The prise de débat, resuming debate. The Honourable Parliamentary Secretary to the President of the Treasury Board.
Thank you, Madam Speaker. And I am speaking strongly in support of Bill C-45, through which our government is ending the failed approach of criminalizing cannabis. This is an opportunity to protect our youth, to take profits out of the hands of criminals, and to treat drug use as the public health issue that it actually is. And I've actively worked to advance this policy since hosting the Liberal caucus in discussion back in the fall of 2011 about the potential legalization of cannabis. So I am proud to stand in this House and see this policy come to fruition. And I'd like to start by giving some thanks to organizations that have been advocating for this very practical and positive new policy. Firstly, Dr. Evan Wood, an emergency room physician who led a coalition called Stop the Violence BC, when he saw the kind of gang violence and gun violence on the streets of Metro Vancouver, including, by the way, Vancouver Quadro, in an award-winning restaurant where 2 people were injured by a gang shootout around the drug trade. And I'd like to thank Brett Harvey and Adam Scorgie. They created a documentary called The Union, which documented the role of organized crime in controlling the cannabis trade. Years ago, I had the privilege of hosting them and their film in Ottawa, where I opened up an event to all members of Parliament and senators of all parties to learn about why we need to move beyond our failed policy that we are actually moving beyond today. I want to thank all of the sound drug policy advocates like Donald McPherson of the Canadian Drug Policy Coalition, who brought forward evidence basis for why this shift was needed, and the many other professionals, healthcare professionals, criminal justice professionals, policing professionals, who have pushed for this change in our country. Lastly, I'd like to thank our Prime Minister for including this in our platform, the Health and Justice Ministers for delivering on this mandate, the Parliamentary Secretary for Health for his leadership, and all members of the Standing Committee on Health for doing good work towards this change that we have positioned our country to do for over 2 years. So this week, we were reminded once again of the importance of this discussion by the RCMP's seizure of 64 pounds of cannabis and 94 mature cannabis plants from the Hells Angels in Kelowna. So that's the reality of our current system, Madam Speaker. Organized crime produces, distributes, and sells the cannabis and uses it to fund their other criminal ventures. It's Hells Angels and other criminals who regulate and control the product and what's actually in it and how to sell more of it to our youth. It's criminal gangs who recruit young people to be part of this terrible criminal enterprise. So far better that government regulate and control cannabis, and that's what C-45 is all about. Le projet de loi devant la Chambre des...
The bill before the House of Commons today has been helped by the excellent work on a working group on regulating cannabis. They conducted an in-depth study and have come up with strict regulations for cannabis.
That the members' offices are saying we need more time, but actually there's been a lengthy, thoughtful process on this already, and it's time to move. And the members' offices that are yelling at me right now are just trying to stop this.
I'd like to say to the honourable member, I'd like to say that if she has comments or questions, she should wait until the time reserved for questions and comments. I am sure that she would also like the respect of other members when she makes her speech. Madam Speaker, adults who are in possession of small quantities of cannabis up to 30 grams will not be treated as criminals. Bill C-45 will allow responsible adult consumers a way to obtain legal substances that have been strictly regulated in order to respond to national standards, high national standards, to ensure security and quality.
Reduce the disproportionate burden imposed on the 18,000 individuals who were charged with possession of cannabis in 2016 alone. And we know that can sometimes mean lifelong impacts from a simple possession charge on their life prospects. C-45 will reduce this travesty and also reduce the burden on the criminal justice system. Our government believes that law enforcement and the courts should devote their resources to criminal activities that are truly detrimental to society, as well as to education and prevention in the case of public health issues like cannabis use. The expert witnesses who appeared before our Standing Committee on Health agreed with our government's proposed approach. For example, Carrie Schuyndler from the Canadian Nurses Association stated that, I quote, Bill C-45 promotes the removal of harms associated with the prohibition model, so much loved by the Conservatives opposite, while recognizing the need to protect vulnerable populations, including youth. Under our current regime, Canadian youth have one of the highest rates of cannabis use in the world. In 2015, 21% of youth aged 15 to 19 reported using cannabis in the past year. Now, some Vancouver Quadro citizens have expressed concerns that legalization will increase use of cannabis by young people. I think the evidence will show that that use will decrease over time with the prevention and education programs that will be put in place by our government. But let's be clear, too many youth are using cannabis now under the system controlled by the criminal gangs. And so this is why the bill includes strict controls and penalties to protect young people and measures to deter and punish adults who provide cannabis to underage Canadians. Deterring the illegal market is necessary to really protect Canadian youth. Experts such as Dr. Christina Grant from the Canadian Pediatric Society has cautioned us that an age limit that is too high risks preserving the illegal market that currently provides the supply of illegal and unregulated and unsafe cannabis to Canadians between the ages of 20 and 40. These are the young people who currently have the highest rates of consumption among Canadians and among their peers in other developed countries. It
is also important to bear in mind the fact that the bill will offer each province and territory the flexibility to set its own supplementary restrictions, which can go beyond those proposed within the federal framework according to the needs and circumstances which are unique to the provinces and territories.
Minimum age if a province or territory so chooses. Beyond the proposed minimum age restrictions and severe penalties for selling cannabis to youth, Bill C-45 also proposes a number of additional controls to protect young Canadians. For example, the bill includes provisions that would prohibit the sale of cannabis and cannabis products that are considered appealing to youth. It would ban the advertising and promotion of cannabis, except in limited and very restricted circumstances. It would also set out requirements for packaging and labeling to ensure they are not appealing to youth. And finally, as various expert witnesses who testified before the Standing Committee on Health reminded us, these measures need to be supported by significant and effective public education to explain the risks and harms associated with cannabis consumption, especially for youth. Our government fully agrees with these experts, and we have already started a national public awareness and education campaign in collaboration with provinces and territories. This campaign will be augmented by the additional $36 million announced recently. Finally, Madam Speaker, in light of the tragedy of the current opioid crisis, I would like to note how an evidence-based public health approach to drug use can save lives. We know that cannabis used for medical purposes like pain relief is safer and less addictive than opioids. In the United States, the legalization of medical cannabis in many states has resulted in up to a 25% drop in opioid-related deaths compared to states where medical cannabis remains illegal. So in Canada, the opioid crisis took at least 2,458 Canadian lives in 2016 and is only growing worse. British Columbia and Vancouver have a disproportionate share, and so I am optimistic that those tragedies will be reduced by legalization of cannabis. So to sum up, this is a thoughtful, comprehensive piece of legislation designed to protect the health and safety of Canadians while indeed saving lives.
And comments? Questions?